Hi, everyone. I'm Molly Lindquist, part of the Manta Cares team, and I want to welcome you to our Patient from Hell podcast club. The purpose of the Patient from Hell podcast club, funded by PCORI, the Patient Centered Outcomes Research Institute, is to bring PCORI-funded researchers onto the podcast to share about their research so more of us can learn about it and use it to help us in our own lives as patients or care partners. And the podcast club gives us the opportunity to chat with members of our community to get their thoughts on each episode. Today, I'm super excited to chat with Nichole Goble, the Director of Community Initiatives of our nonprofit partner, Caregiver Action Network. Caregiver Action Network is the nation's leading family caregiver organization working to improve the quality of life for more than 90 million Americans who care for loved ones with chronic conditions, disabilities, or disease, as well as those supporting the living needs of older adults. So, we're going to speak with Nichole about her personal experience as a caregiver, the work that Caregiver Action Network does, and get her thoughts on episode 44 of the Patient from Hell podcast, Navigating Geriatric Oncology, Clinical Trials, and Patient-Centered Care with Dr. Supriya Mohile. So, Nichole, with that, I'd love to have you give a brief introduction and describe a little bit about the work that you do at CAN.
Yeah, thank you so much. I'm really excited to be here. So, yes, I'm with Caregiver Action Network, and we serve the uh, tens of millions of family caregivers in the United States. We're an organization that serves caregivers across the lifespan. So, everything from, maybe what we stereotypically think of when we think of a caregiver caring for that older or aging loved one, parents, grandparents, etc., to maybe those parents that are caring for a newborn that's been born with some significant healthcare issues, a disability. So we really run the whole lifespan in terms of the caregivers that we serve, and obviously nestled in that are those that are caring for loved ones with cancer. And that's a huge number of folks that reach out to us as well. So a lot of our resources are online because caregivers want something that's accessible, that they can pull up, share with other members of the care team. So pretty much all of our resources are on our website in what we call the caregiver toolbox. And it's really great because it allows folks to be able to kind of go and poke around and find exactly what they may be looking for in a moment. We also have the Caregiver Help Desk. And the Caregiver Help Desk is an amazing resource that is accessible via phone, chat, or email. And it's kind of what it sounds like. It's a little bit like a customer service line for family caregivers, because sometimes you have that question and you want a one-on-one kind of interaction to just have someone listen, and then have someone that can take that in and start pointing you in the direction of some resources and information that's going to be really, really beneficial to you. Um, we also really use our interactions and our engagement with all the family caregivers that we have in our network to amplify the voice of family caregivers. If you follow us on social media, you'll notice that so much of what we put out there is in the voice, in the experience of a family caregiver. Because when people come and look for the resources, not only do they want to be able to find it, but it's got to be something that speaks to them. It's got to be something that they can see themselves in. And so we really take that to heart and make sure that we're really putting the caregiver voice and experience first and foremost. And a small section of that is we are based in Washington, D.C., and because of that, we do a little bit of advocacy work as well. Um, so when we're talking about like clinical trials, which I know we'll chat a little bit about later, being able, when you have these lawmakers and decision makers here in DC that are, putting forward some bills, some pieces of legislation that have a huge impact on access, we want to be able to kind of come to the table with the caregiver voice as well, to say this is kind of how some of these things impact the caregiver experience and something to consider when making these decisions. So that's a little bit about the work that we do here at Caregiver Action Network. And one of the unique things that kind of underscores all of that work is we are a small staff, but obviously caregiving, I think, is really something that we've come to appreciate as a lived experience. We always pull out the Rosalind Carter quote about caregiving to amplify that caregiving is really something that's going to impact us in some way, shape, or form in our life. And so all of us have our own kind of caregiving, personal caregiving experiences. And, I cared for my grandfather who had bone cancer and had the honor of really being his primary caregiver up until his passing. And it was a really kind of life-changing experience. I at the time, my grandmother had recently passed from COPD, and he was living on his own. He had been diagnosed with cancer, but had hid his diagnosis from us because he wanted us to all be focused on my grandmother, because she was at kind of the end of her battle with COPD. And so I want to say like maybe like 3 or so months after grandma had passed, he told us, oh, by the way, about a year ago, I had been diagnosed with cancer, and now it's spread, and now it's bone cancer, and I am going to need some help. And that time I had just started a new job, had some flexibility, but chose to kind of take a leave of absence from that job and become my grandpa's roommate and be there with him during the week and have support from my mom and my sister and some other family as well. And so I think it's, not only personally was it such an impactful and I think poignant part of my life. I was really close with my grandfather all through growing up. He was part of my care team. I'm someone who was born with a rare disease. So, my grandparents were always, there for me when I was in the hospital. And my mom was a single parent. And so they would always be there to chip in if she needed someone to help with some care. So, it's something that really, I think, in a lot of ways guides, a lot of things that I come to the table with as well, really tapping into that experience and, other caregiving experiences in my life too.
Wow. Nichole, thank you so much for sharing that. What a beautiful full circle for you and your family, really, you've experienced this really from all sides. And I think that's what we at Manta Cares, we're all cancer survivors, caregivers. We've all kind of walked that path. And exactly to your point, I think, that lens of having experienced it informs, everything you go on to do. I think it's wonderful that you ended up in this caregiver space because, again, clearly you get it on so many levels. I'm curious, I know, and I'm sure you hear this, more than we do, but, in terms of balancing kind of those personal relationships with, the caregiving piece, which can be a lot, a lot of times it's really in terms of hours and labor, taking on another job. Did you find anything, in your experience that, helped kind of maintain the relationship you had with your grandfather while also being able to be his advocate and kind of, care partner on the other side of his experience?
Yeah, that's such a important piece and something that caregivers in any kind of caregiving scenario, they're not really prepared for when they take on that role of caregiver. So many people feel like once they become a caregiver, once, providing that additional support or care to a loved one, that becomes kind of all consuming. And they lose other pieces of that relationship and that dynamic with that person. So if you're caring for a spouse, that can have a real impact on that relationship. Caring for a parent. Again, you have, a lot of folks will talk about the role reversal, right? Where my parents were always kind of, the people who kind of had that upper hand and were, kind of the guiding light for me and telling me what to do. And now I'm in a role for them providing that support. And so it can be really, really challenging. I think in my personal experience with my grandpa, we'd always been really, really super close. And I think that for him, obviously, because he had also kind of been my caregiver too, I think that there may have been some, even though I think he had wanted family, he was very explicit when we were talking as a family about, what this would look like. My grandparents had been very, I think, proactive in their thinking. And, they had, I think it was long-term care insurance, that they had said, when it comes time, this can be used to put us into like an assisted living facility. But that wasn't what my grandfather wanted. He's like, I don't want to go to an assisted living facility. I want to be with my family. And so we really had to kind of strategize of what that could look like. And I think, starting from that point, I think that was a huge step for him, but it was really uncomfortable because he didn't want to feel like he was a burden on us. I think it was also just really, really kind of a change for him. He wasn't used to his granddaughter being like, Grandpa, take your pills. Grandpa, it's time to eat. Grandpa, you have to do this. That was uncomfortable. And then, of course, some of the other aspects of care can be very personal. And I think that was also, a little uncomfortable. And we navigated that in a couple of different ways. One would be like, well, Grandpa, this is just, like we have to figure out a way to do this. So you got me and we're going to make it work. Or, if you're comfortable with, someone else coming in and helping out, maybe we can kind of figure that out as well. So especially towards the end, we had some hospice care come in because there were some medical aspects that they would help with that were a little outside of my wheelhouse. And, my grandfather was a really big man. I'm 4'8". And so, we also needed some help with some logistical things because it came to a point where his mobility was really impacted. And me trying to get him to the bathroom or get him, to a position was really, frankly, unsafe. And I in no way wanted to put him in any risk. And so it's like, Grandpa, I'm not doing this because I don't want to do it, or it's just, I don't want to hurt you. I don't want to fall. I don't want anything bad. So, I think it's, one of the things that, coming full circle to the work that we do here at CAN, a couple of years ago or so, we did a campaign in National Family Caregivers Month called Caregiver and it was an opportunity for caregivers to share who they are outside of their role as a caregiver. And a lot of folks also spoke to the relationship that they had with the person that they care for. Because frankly, there's a lot of people who don't necessarily like the word caregiver. You know, I am husband, wife, spouse, I'm a kid, I'm parent. You know, it really is about keeping that relationship, that personal relationship at the forefront. And that is 100% okay. And it's okay to give yourself a little bit of grace when you have those challenging times. You know, just always take a step back and think and remind yourself of that personal relationship. And, you know, think about how you would feel in, you know, your loved one's situation. How would you want someone to, um, you know, provide certain pieces of care or handle certain issues? So it can get a little complicated, but you know, the personal relationship is so important, and we always like to bring folks back to that you know, in those challenging moments, it's okay to put that relationship first and foremost. Remember that, you know, outside of being a caregiver, you have this relationship with your loved one.
Right. That's amazing. And also, you're human. And so it's okay to feel overwhelmed. And it's okay to, I know, resentment, no one really likes to talk about that because it, invokes these feelings of guilt. But, your life changes when you take on these different roles. And I just think that giving ourselves grace is sometimes the most difficult thing when you're trying to do the best you can for someone that you love or someone that has taken care of you. So,
Right.
yeah, really beautifully said. So, Dr. Mohile's podcast, did anything jump out at you that resonated or surprised you, or any kind of tidbits?
Yeah, I mean, I think it was just really interesting. Clinical trials and in kind of those logistics are something that we have a lot of caregivers reach out to us about. And we have a specific resource around navigating clinical trials because it is a question that pops up. A lot of folks are uncertain about them. They hear things, you know, whether it's coming across a podcast where there's someone, you know, sharing about clinical trials, maybe certain advancements, and then the caregiver is like, is this something that would be appropriate for us? I want more information. And, or they can say, this sounds really great, but I'm nervous. Like, is it safe?
Right.
Um, and so I really love just having that perspective from kind of that medical lens because it really is about marrying kind of that. One of the things that we always talk about with caregivers is that you are an advocate and a voice for your loved one when speaking to medical professionals. Medical professionals have amazing insights, knowledge, expertise, and it's crucial. But no one knows your loved one the way that you do.
Yep.
And so it really is kind of a joint force here of, you know, having that expertise, that knowledge, that guidance, having a doctor provide some of that information about what, you know, what's out there. How do you figure out if it's something that's going to be appropriate for you? And then you can be able to provide some of that insight on your loved one. Treatments, therapies, they can sound really great, but they may not work for you or your loved one. And that can be a really difficult kind of thing to grapple with.
Mm-hmm. Yep, that makes complete sense. Nichole, I think we could talk for like an hour. I feel like I'm learning so much from you and so grateful for you sharing your personal experience as well. Because again, I think that makes, kind of the tidbits that you're sharing incredibly useful and actionable for people. I think maybe to close our podcast club, if you had one piece of advice that you could give yourself when you first started helping to care for your grandfather, looking back, what would that piece of advice be?
Wow. When I think about that experience, I do think a lot about being frightened, scared, unsure. Um, because I remember going to the first medical appointments with my grandpa. And even though, like, I felt like I was a pro at going to the doctor because of my condition, and it's like, this shouldn't be a problem. I was petrified. Had this fear in my mind, this completely irrational fear that if I asked the wrong question, if I said the wrong thing, they would take my grandpa away. They would be like, you can't take care of him. You're obviously incapable. And I really had to fight against that. Because my grandpa could speak up for himself, but how many times do we go into those situations, into those doctor's appointments, and the doctor's saying, how are you doing today? And our loved one will say, fine. And you're sitting there like, what? No, like,
Right.
no. And like, actually, doctor,
Right.
here's a couple of things that I would like to bring up with you. And so I think, if there's one piece of advice, it's give yourself grace to ask, to learn, because you're doing the best that you can. It's very easy to kind of fall into a cycle of, I'm not doing enough, I don't know enough. But know that you are doing enough. You're doing everything that you can, and uh, always find spaces, find ways to ask questions when you have them. Seek out answers from those medical professionals, from your fellow caregivers. Such a powerful community to have. And in that way, you're not feeling like you're navigating so much of this alone.
Yeah. Oh, I think amen to that. I think it's so easy to feel isolated, whether you're a caregiver, whether you're a patient. And I think the power of community and knowing you're not alone is huge. So thank you so much, Nichole. We are going to link to Caregiver Action Network. Super grateful for all the great work you all do. And again, thank you so much for being a part of our podcast club.
Of course, thank you so much for having us on here.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.